This conference will now be recorded.
Hello again, everyone. My name is Paul Weber, and I would like to welcome you to the second teleclass lecture this year that is being recorded on video. This is the second One Health teleclass lecture that we've recorded this year. The title of this lecture is Rethinking Solutions for Public Health Problems, a holistic One Health social science systems approach. And I am absolutely pleased and delighted to be able to introduce Dr. Laura Streichert. Now, Dr. Streichert's education and experience makes her uniquely qualified to present this topic. She is a population health scientist and has worked across disciplines and across sectors at all levels of public health. She began her career in research studying neurodevelopment at Stanford University, which sparked an interest in integrated system level approaches. She received her MPH from the University of Washington's renowned and innovative community-oriented public health practice program. As executive director of the International Society for Disease Surveillance for more than 5 years, she has led efforts to advance health surveillance through capacity building activities, especially related to public health informatics and the use of syndromic surveillance. Dr. Streichert's interest in global health began as a Peace Corps volunteer teaching math and science in Nepal. She helped to launch the One Health Social Sciences Initiative and is currently active with the One Health Commission's Council of Advisors. More recently, working with a young Ugandan leader that she met through a global One Health Network program, Dr. Streichert co-founded a nonprofit in Uganda that's dedicated to empowering women and increasing access to clean water. Today's teleclass will demonstrate the value of integrated One Health approaches to disease control and prevention, and will review some of the latest research in the field. To present Rethinking Solutions for Public Health Problems, I am honored to present Dr. Laura Streichert. Laura, the floor is yours.
Thank you very much, Paul, and thank you for the Weber Training's ability to reach such a large global audience and make information accessible. I'm very happy to be here today. I know my title is quite a mouthful, and I'm going to unpack it. I want to start. One second. I want to start by just saying a little bit about, from my bio, you can see that I've had quite a career that has gone across disciplines and sectors. And one thing that's very interesting is that there is a common thread woven throughout them. I began my career studying neural networks as a basic scientist, and then as I became more interested in public health, my work evolved to include community organizing and looking at the role of community and social determinants of health. So if we go from neural networks to global networks, you can think, well, what's the connection there? But actually, there are a number of common features. You know, it's about network connections, about the interactions between items, and then reinforced patterns of activity, which then lead to chain effects. So today I'm going to be talking a little bit about how that appears in a practical context. So again, my title is quite a mouthful, but I wanted to include all of the elements that are really captured in this idea of One Health social sciences. This idea of rethinking solutions for public health problems. If the COVID-19 pandemic has taught us anything, it's that there is work to be done, and we need new approaches to respond to dramatic public health events that arise and that are going to continue to arise. We need to look not just at the pieces, but at the connection between them and to take a holistic view. So when we think about holistic medicine, we refer to looking at the whole body, both the social and the biological components. It goes back to this idea of the socio-ecological model, which is prevalent in public health learning. This idea that there are many different levels to look at health, and that they are all interconnected, and to understand the whole picture, you need to look at the parts and how they're combined, from both the individual level to the role of public policy. So this is why, again, there's a need for a systems approach, and One Health Social Sciences, I'll explain, is a good solution for that approach. So today, what I'm going to do is to review some One Health principles in the context of social sciences, and then present some practical examples from my experience in global settings and in Uganda, Nepal, India, and the United States, and to introduce the One Health Social Sciences Initiative, which is an organization that I helped found to move things forward. And then also the bottom line of this, and also of the Weber trainings, is really to promote the advancement of a skilled workforce using the best available technologies, working on the most significant issues. And that's what the people here on the call are. So I want to start with a definition of One Health. One Health is an old concept, this idea of there needs to be consideration of the interconnection between animal, human, and environmental health. Recently, and there are a number of organizations that are working on this, but recently, to sort of put everyone on the same page, a One Health leadership committee that was commissioned through the tripartite, which is the World Health Organization, the FAO, and the OIE, looking at animal and agricultural and human health, came together to come up with this definition, which I will read. One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent, and that the approach of One Health mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats to health and ecosystems, while addressing the collective need for clean water, energy and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. So in creating this definition, they specifically pointed out ways in which One Health could be applied. And so while you'll often see some image of One Health being a Venn diagram of animal, human, and environmental health, what's shown here is, in this one, is also actions that can be taken through the One Health approach to actually identify pathways and design systems and other approaches. So why learn about One Health? One Health is increasingly being recognized as an important strategy for addressing what we call wicked problems, complex problems that are constantly changing. So this new definition of One Health really will help to promote a clear understanding across disciplines, again, to get everyone on the same page. But the main thing is, by having these organizations work together, we can begin to mainstream and operationalize One Health at the global, regional, and national levels. I should mention also at the local level, which is the level that I'm going to be speaking about the most. And it also provides some support for countries that are helping to establish One Health and operationalize it by articulating One Health in its national targets and priorities. This can help mobilize investment and advance equitable and holistic solutions. So again, this is from the CDC. It's just, our world is becoming more complicated every day, it seems, and One Health is a way to tie things together. Now, the idea of One Health is not to create a new silo, but to take an approach that is very, that combines everything. Specifically, One Health can reach public health goals, as I say, at the local and global level. And another centralizing idea is the UN Sustainable Development Goals. As they say, that which gets measured gets done. So by identifying these are the areas that we need to make progress, and then if you look at them, you can see that One Health, this idea of the interaction of human, animal, and the human, animal, and the environmental health, you can see there's a way that you could connect it to every one of these sustainable goals. And so that One Health provides the tactics and the means to achieve the goals. And then the One Health social science approach takes that a little further and makes the solutions practical and sustainable. So One Health is a social phenomenon. You know, going back to the idea of the socio-ecological model, where we can see individuals, but together we create very complex systems, whether it's people, animals, aquatic organisms, or trees, but also connected to our own living and built environment. So there are many things to think about in a somewhat complex way. Specifically, I wanted to give an example of how we can envision the interconnections between human, environmental, and animal health. So this is an example that says not only do we look vertically at the different levels, but also horizontally. So if we think about what are the points of interconnection on a planetary level, we can think of things such as climate. If we use the example of heat waves, so how does heat affect global populations of animals and humans? And then we have this shared environment. So if, for example, we're living in a city or in the country where there's extreme heat stress, this is something that is related to both people and animals, and then will also be related to the neighborhood green space and pavement, for example. Also, shared exposure. So both animals and humans have this shared exposure, and what we can learn is what are the outcomes from that shared exposure, and then the clinical relationships of how do the manifestations of disease come out in both animals and humans. The field of comparative medicine has long been an area where where we've been looking at the comparisons between health and animals and humans, and then also this shared bond, which touches upon the social aspects. Now, I just want to say I've put some of the sources here. At the end, I'm going to include a list of the references, so you'll have that. So to just be sure that people understand this separation or dichotomy between natural science and social science. So if you think of natural science as the study of nature, generally it uses quantitative methods, they're controlled experiments, and we have examples from biology, ecology, physics, human medicine, and veterinary medicine. Social science is the study of human context, where we're looking at experiential data, empirical studies, and that are uncontrolled variables. At one time, I was doing both some science experiments, neuroscience experiments, and also some social science work. And although if you looked at the abstract from the natural science experiment, the neuroscience, it seemed so complicated and had such jargon. But in some ways it was simpler than social science research, where you really have so many confounding variables that it's very difficult to actually to tease out what are the factors that are really important. And so the methods of social science generally include qualitative or mixed method studies that look at qualitative methods, including focus groups, field work, and surveys. And so we see this work, both examples of disciplines could be economics, psychology, sociology, and other fields. Now, when we think about specifically infection prevention and control, One Health solutions are especially relevant. Zoonosis is the field that is most typically associated with One Health solutions. So, zoonosis is the disease transmission between animals and humans. And 75% of emerging diseases are zoonotic. So if you are in a health field, it's very important to have a basic understanding of zoonotic disease. What are the mechanisms, what to look for, and as Dr. William Fagey said, you can't tell the story of human health separate from animal health or environmental health. And there are a number of issues that come under the umbrella of One Health, including zoonotic disease, antibiotic resistance, and some of the others that are mentioned there. Now, why use a One Health approach? So a One Health approach seems to fit the bill for looking at systems, but why? And I want to refer to an excellent report that was produced by the World Bank about a framework for operationalizing One Health. And I want to just take you through this figure to show that on the x-axis is time and the y-axis is amount of zoonotic disease or amount of disease during an outbreak. And we see that first you would see an exposure in animals, and then the animals get sick. And then there's events that lead to exposure in humans, which then become clinical signs in humans, and then humans seek medical aid. So you can see this sequence of events. And if you look at how this is related to the cost of control outbreaks, you see that the longer the time goes, if you wait until you see clinical signs in humans to begin to take action, that this results in an incredible cost of control, cost of the control outbreaks. So another rationale for applying One Health solutions is the consideration of the cost savings. Now, I'm not going to talk much about COVID-19, but I just want to put COVID-19 within a systems view perspective. So we see that there is, still we don't know exactly the source, but the idea of coronaviruses are spread both interspecies, and then there's a cross-species transmission. With COVID-19, the belief originally was that there was some transmission in wet markets, which then gets transmitted to people. That's how people pick it up. And then this is amplified through contact with others and with air travel. If you ever look at that figure of all the planes that are in the sky at any one time, you realize that, infectious agents do not recognize borders. And then what I have on the right here is this example of a causal loop diagram. So causal loop diagrams are ways to show the connections between different things. And at the heart of systems thinking is the need to look at the arrows and not just the variables. It's really the relationships between things. And this is how we can go forward to look at building resilience. So if you know how things are interconnected, no matter what the disease situation is, you get a broader and deeper understanding of infectious disease transmission. The other thing I want to point out here, especially with regard to COVID-19, is this causal loop diagram looks at the components of the society interacting. So how do you reconcile what seems like a simple diagram of how animals disease is passed to humans, but even with then you have to overlay this idea of looking at the course of the disease too, the exposure and leading to symptoms and recovery. And so there are so many factors to consider. And so One Health tries to break that down a little bit. Now, I wanted to, again, this is similar to the figure I showed, but again, want to stress why and how a One Health approach has an important effect. So if you look at this figure, you can see that the wild animal cases, there are always going to be wild animal cases of coronavirus. But the idea is what happens is you get spillover both within species and to other species. And often this may be from wild animals to domestic animals. And then what you get within the domestic animal population is an amplification, which then spills over to humans, which then gets amplified. And so you get this high incidence rates in humans and animals. And so by reducing this through forecasting readiness, early detection, again, perhaps by people across sectors working together, what you find is this light green is, which is the incidence of disease in humans, in animals, is much smaller, as well as the human amplification. So what you see over here, this darker green and the blue, is really the benefits that you see to animals and people. Now, because One Health is a social construct, it's a great way to consider the effects and the importance of social justice and gender equity. These are issues that have come to rise as essential for really any health, public health, veterinary, any action. The idea of recognizing and addressing the inequities that we see. This is the classic diagram I just wanted to include about the difference between equality and equity. It's really not just giving everyone the same thing, but being able to adapt interventions and what's needed based on disparities. So if we consider vulnerable populations, gender, socioeconomic status, culture, occupation, disability, age, and then connect that with thinking about the social determinants of health, whether it's money, education, and social constructs, we can see that One Health Social Sciences can address the diseases that often have a quite unequal distribution of effects. This is just something from a local San Diego news that demonstrates that this was about an environmental problem which enclosed Imperial Beach, which is an area that has high incidence of lower income and Black and Hispanic people. So when we think about specifically about gender issues and women, think about the health risks for women. Women are caretakers of infected people. They often are the ones with direct contact with livestock. And so they have an increased vulnerability. Also, the cultural practices, both with regard to roles of women and what they do, are very important. Also, specifically, we might see the effects of poverty on house sanitation and hygiene. I looked at this. This is a photo of a woman that I met in Nepal, and she was walking down the trail with this huge basket of grass for her animals, cuttings from trees. And with her, so she's walking with this huge basket, and with her are two brothers who aren't carrying anything. And I asked her, Kina tapaiku baiharu nalagani, why aren't your brothers helping to carry you? And she just sort of laughed with an expression that said, as if. Well, this is something that slowly will change. And so when we think of goals for improving gender equity, we need to better understand these gender-based risks, and also the idea that we need gender-sensitive public health education, partnership with local communities, and most importantly, we need to empower women as decision makers. And so when we think about improving the efficiency and effectiveness of policies and intervention, gender must be factored in all disease prevention and control programs. So When I began the One Health Social Sciences initiative at the One Health Commission, which I will tell you a little bit more about, one of the first talks we had was by an anthropologist named Dr. Severine Tees. And I have to thank her for presenting the idea, some of the concepts of social science as it relates to One Health in a very simple way. And one way that you can think about it is, what are the differences between the real and perceived mechanisms of disease? So she had done a number of studies in Africa, conducting focus groups, interviews, and participant observations. And she found that the way that people thought disease was transmitted between animals and humans was different than what really exists. So until you can build understanding and demonstrate the mechanisms of disease in a way that resonates with the culture of a community, you can't really move forward. So, so the idea is that transmission dynamics are biosocial as well as biomedical, and that another reason for integrating both natural and social sciences is the idea that you need both the data and the stories to lead to a deeper understanding, which then lead to practical and sustainable solutions. I want to switch to a specific case about a case study of rabies in Nepal. So as we mentioned, I was a Peace Corps volunteer in Nepal, and I wanted to say a little bit about rabies. So it's found in over 150 countries, and the thing about rabies is it's almost 100% fatal. I believe there are reports of maybe 5 people who have survived rabies once they get symptoms. So it has a huge global cost. And worldwide, while the majority is from dogs, bats, and other wild animals such as jackals and foxes are also sources of rabies infections. So some of the things that you can do is vaccinate dogs and prevent dog bites, but also it's also recognizable by the need for rapid action is really important. So just again, specifically about some of the socio-cultural beliefs, you can't, I spoke to a leading rabies researcher in Nepal, and he told me of some of the stories about cultural beliefs. So they believe, many people in the village believe, you can't get rabies from a puppy bite. Well, that's not true. If you have no symptoms within 3 weeks, you're okay. Well, that's not true. Wild animals never bite people. Well, they do. And then one really interesting case he mentioned was about this lack of knowledge about interspecies transmission dynamics. So this was the situation he described. So because of habitat pressure from jungle clearing, more of the wild animals are coming in closer contact with farms and with people. So a wild jackal with rabies will attack a farmer's chickens. And so the farmer sends his dog to go get the jackal. What happens? A fight ensues. The jackal bites and transmits rabies to the dog. Now, sometime later, the dog bites, shows signs of rabies, bites and transmits rabies to the farmer. And then the farmer doesn't know really exactly what he should do. He doesn't receive post-exposure prophylaxis. And then the dog dies and the farmer dies. So this is a sequence that is actually not uncommon. I just had to put here again that my pictures from when I was a Peace Corps volunteer, and then when I went back in 2019, and where I was able to see firsthand the dramatic changes that have occurred in public health in Nepal. So with regard to what can you do? So again, there's this need for communication, collaboration, and coordination, which are the 3 key points that were brought up by the WHO and that tripartite definition. So we need knowledge transfer and working across sectors. So perhaps having contact lists, making it easy for people to do to get in touch with one another. Also, there needs to be a stakeholder analysis to really understand the culture. For example, in Nepal, there's an annual Hindu festival called Kukur Tihar. And this is when the dogs are worshipped to please Yama, the god, because dogs are messengers of the gods. So again, when you come in and say, okay, there are a lot of rabid dogs, we need to cull the dogs, you're going to get pushback because of the role of culture. And this is where the social science aspect of One Health comes in. Also, practically, the idea of perhaps coordination with regard to conducting concurrent animal and human vaccine campaigns. So if you look at some of the barriers to action, such as people have to come in long distances, perhaps to get their dogs vaccinated or to get themselves vaccinated, that by working together across veterinary and medical medicine, you can come up with solutions that have broad effect. I'm now going to talk about a case of rabies in the USA. Now, this was a really interesting case that was reported in an MMWR report. MMWR is the CDC epidemiology journal and it's called Morbidity and Mortality Weekly Report. And this was a very interesting case that really highlights the need for a One Health approach. What we see in this case, I invite you to see this case. We find that a 56-year-old woman came in with no pre-existing conditions, and her arm hurt gardening. And so first she got a diagnosis for carpal tunnel, and then she was acting really weird, so they treated her for panic attack. And then this developed into acute cardiac effects. But it wasn't until almost a week later that the hospital staff asked about animal exposure. And only then did her husband say, oh yeah, she was on this yoga tour to India 6 weeks ago, and she was bitten by a dog, and they cleaned it up and they told her she was okay. So then that, turned the light on. Meanwhile, the patient is receiving very extreme medical interventions. On day 8, the specimens were collected to CDC. Rabies are confirmed on day 9, but by then it was way too late. At that point, the family withdrew medical support and the patient died. So the question is, how could this case of rabies been avoided? And I actually conducted an activity with nursing students at Olympia College in Washington State and asked them to come up with thinking on a systems view, looking at this One Health social science approach. What are some of the ways that the rabies could have been avoided? And these all are practical solutions that can come under a banner of One Health social science solutions. So, for example, whether it goes from rabies control in India, guidance from CDC before people went, and also more information about travel medicine, but also this idea about asking about animal exposures as part of health history. It's very hard to add a new question to medical histories. One thing we have done, COVID-19, if anyone has gone to any healthcare, needing any healthcare since COVID-19, the question they always ask you now is, have you traveled? Where have you traveled? So what we need to see with a One Health approach is a question with regard to exposure to animals. And then also, how could this diagnosis been made more promptly? And specifically, when you look at this case, there were 200 before the diagnosis was made and before it was all over. 250 healthcare workers had been exposed in the urgent care, the EMS people that came for her in the ambulance, the hospital, the funeral home, the medical examiner. Everyone was subject to exposure, and it cost the hospital over $235,000 in post-exposure prophylactics alone. And there are also additional costs. So again, if you think about how this could have been made, and specifically think about points of intersection between animals, humans, and the environment, you can come up with useful solutions. I'm now going to switch to a case study in Uganda, a small nation in Eastern Africa. Now, if you think about water as a One Health issue, it is, again, it's a platform really for thinking about the intersection of animals, humans, and the environment with regard to health, and specifically as it relates to waterborne diseases, the dangers from human waste, animal waste, and pollution. And if we see, you can look at these figures and you can see data on populations without basic drinking water. And, when you look at this picture and you see that there are literally millions of people that have no access to improved, meaning piped water, you see that it really is you can see that it's a problem. But I'd like to say that when you look at these photos, you get a much clearer idea of the reality. I always think that this photo really captures, this one on the left really captures the One Health situation as it relates to safe water. Here you see a river that is subject to drought and flooding, which is getting worse as a result of climate change. You see animals and people sharing the water source, collecting contaminated water. Also, it's the role of women and their family. Now, this girl isn't in school because she's collecting water. And often water collection is an important responsibility of women and children. And again, when you think that this is where people are driven to for water, you can see the urgency of the situation. Now, COVID-19 has made things even worse because water in Uganda, clean water, is something that many people have to pay for. So if you have piped water to your house or piped water to a borehole where people often have to pay for jerry cans of water, what happens is, as a result of COVID-19, many of those incidental jobs held by women for cleaning, cooking, various activities, what happens is they don't have that money anymore. So one of the first things that happens is they don't pay for water, and then they're driven to sources of free water from undeveloped sources such as this. So although it may be free with regard to cost, it has often significant costs. So looking at this situation, I learned about this situation by speaking to a woman named Ms. Aisha Nankanja, who was on one of the One Health Social Sciences general meeting calls. And what this is also a great example of how through these networks we can connect with people, even from here in the US to there in Uganda, how to connect and make things happen. And so working with Aisha, she's been involved with empowering women and water issues in Uganda. And so what she and I did is, and with another group of young Uganda leaders, is we created this organization called the Rural Water Initiative for Climate Action. And the vision of RICA is a world where rural communities live and prosper in harmony with nature to meet their water needs and to build resilience to climate change. And so one thing about what makes RICA unique is this One Health holistic approach. Our tagline is rethinking how we live with nature. And this is something that resonates with people in Uganda. So again, you need to have, if you're trying to do something with communities, you have to consider where they are coming from and what's important to them. And so what Rika has done is address clean water through One Health approaches that look at community empowerment, conserving the environment through tree plantings. We recently put a new water tank to harvest rainwater at a primary school. Now, these are grassroots efforts, and what you need are what you need are interventions from the grassroots to the policy level. And while a lot of work is being done about wash issues in Uganda, there are still tremendous and immediate need among the most marginalized people. And so Rika again shows what you can do with impassioned people trying to make a difference in their communities. Now, the final case study that I wanted to present is about snake bite in India. Now, snake bite is not a zoonotic disease, and actually it was recognized as a neglected tropical disease by the World Health Organization. And so snake bite is a significant source of death and non-fatal and morbidity and mortality. And it's a very complicated issue, which again is becoming more important in light of climate change, and also in light of development that what is happening in India and also in Nepal is you're seeing a pressure on habitats which are moving the snakes into the fields, and then people are getting bit by them. So there's a lot of effort about trying to address snake bite. Now, with regard to the One Health social science solutions, again, this idea of building understanding, having people, both wildlife control and human health people work together to provide joint training, and also understanding what the true incidence of a disease is. That surveillance is always an important issue with regard to data and equity also. If you think about surveillance and collecting data to inform decision making, if you're not part of the data that informs decision making, then you're not part of the solutions. And one thing about snake bite, which goes back to this idea about religious and cultural practices. So in Hindu culture, cobras are revered and are important parts of their religion. And so there's an anthropology concept called perspectivism that can be applied here, which means you have to entertain the idea that there are alternate realities. So for example, when we think about this division between animal health and human health, well, if you believe strongly that animals can embody people, or that people once had an animal state, then you have different attitudes about things like culling animals or killing all the snakes, which you also don't want to do, because snakes provide a very important role in keeping rodents down. So again, if we could draw that causal loop diagram for snake bite, we'd see that there are a lot of different things and that they are all connected in multiple ways. And so understanding that system is needed before you can come up with solutions that are effective, practical, and sustainable. So moving ahead from these cases, we think about, well, how does this all happen? Well, we need a One Health workforce. And the idea of One Health workforce is people that have some understanding and ability to apply One Health concepts. So by strengthening these connections, we can advance innovative and interdisciplinary approaches. And then also ensure the sustainability of, we need to sustain the ability of education systems that address One Health. And what this does is it will help to support the development of future One Health decision makers and also maintain momentum for new practices. Education and training is an important component of reaching these goals. And as we say, that which gets measured gets done. So having One Health competencies as part of an academic curriculum is one way to ensure that these topics are addressed across disciplines. And this has been the study of an increasing number of publications about the importance of integrating One Health into medical, nursing, public health, veterinary education, and other disciplines. And from One Health Social Sciences, we see that really what remains a large gap is the teaching of One Health in social science disciplines. And one sequence of events that explains this is this idea of you need to, any solutions or getting from one place to another involves change. And change is a difficult process. And so one of the first things is to determine readiness for change, and then provide targeted One Health trainings, which improve the One Health workforce, which increases One Health actions, which would then lead to integrated One Health systems. So that is the theory of change here for why it's important to have One Health education and training. And this talk itself is one example of being able to broaden awareness and understanding and hopefully application of One Health. Now, how does this come about? Like I said, it could come about from a talk such as this, but there's also an important role of One Health networks. Throughout the world, there are hundreds of groups that have come together to consciously bring people together to look at the role of One Health to address infectious diseases. Now, I want to say I want to tell you about an example of the role of how the idea of the role of One Health networks was highlighted. So there was a call. One of my colleagues, a colleague of Cheryl, who's executive director of the One Health Commission, and I, Dr. Victor Del Rio Villas, he is in charge of the Global Outreach and Response Network at WHO. He's based in India. And he said, we would like to have more people with expertise and experience in disciplines from anthropology, epidemiology, everything. Can you help get the word out about this? And so we sent out a call for people to get involved with the Gorn, and they got a tremendous response, an unprecedented response. And so what it got us thinking was, what is this role of One Health networks? And so we formed a multi-sector and global research team. And here's a picture of our research team and a map showing people were in the United States, Germany, Denmark, India, and Scotland. So people were all, but we came together through the wonder of Zoom and put together this research project to look at how is the One Health community involved with One Health networks. Are they involved with COVID-19 response activities? The COVID-19 pandemic has provided a natural experiment, if you will, to see, are people in the one working and applying One Health approaches? Who are they? What are they doing? And what do they need to do their job better? So that was the purpose of this global survey. We also looked at what are the activities of One Health networks that are most important and some of the barriers to engagement. And what we found is that we had over 1,000 responses from 94 countries. And we looked at the location, the type of organization, the sector. Do they participate in One Health network activities? Which ones do they find most useful, especially as they relate to the involvement in COVID-19 response, and again, the barriers to participation. And what we found is that what we thought was interesting was that increased public awareness of the value of One Health was one of the things that people thought was most important as a role for One Health networks, and that the barriers across regions were different. And so if we take this information about who is the public health workforce, what are they doing, this study, what we can do with the results from this study is devise and design future studies that can look more specifically to specifically target what do people need and how can we get that to them to build this workforce. So what we found was that indeed participation in the One Health network is associated with involvement in the COVID-19 response. And from this graph, it's a little misleading because the ends are so different, but there's a significant difference of those from this survey among the respondents that were involved with One Health networks or not. And we left the definition of a One Health network very open in that we didn't define it because this was about perceived connection to being involved and connected with others in One Health. We also did a sub-analysis of social science and the COVID-19 response to look at what is the type of work that social scientists do. Again, there aren't many areas where people have looked at this combination of people working in social science and people working in One Health. Again, if we can understand where people are and the type of work we're doing and gauge their interest in One Health, then we can begin to develop training and opportunities to build workforce capacity. So I've mentioned this One Health Social Sciences Initiative. This was developed as a project really to meet a need that we identified by working with the One Health Commission. So it turned out that there's a lot of stuff being done, but nobody had really addressed this idea of the role of social sciences in One Health endeavors, and that there was no place for people to come together to examine it. So we created this work group called the One Health, well, it's a working group of the One Health Social Sciences Initiative, and the mission to strengthen the network of individuals who incorporate social science concepts and methods in research applications that link human, animal, and environmental health within this social science concept. So some of the activities, the actual actions is we have that again fall under these ideas of communication, collaboration, and coordination is we provide a platform that One Health Social Sciences provides this platform for people to meet through regular meetings, feature presentations, and opportunities to network. I mentioned earlier that I met Aisha working in Uganda through a One Health Social Sciences meeting, and she contacted me and said, you know, I'd like to do this. Can we work together? And it has blossomed into this incredible collaboration. And so I encourage you, you know, the message of that point is don't be afraid to reach out to people. People want to work together. People are open to new ideas. And so if you have an idea or you want to do something, you know, it really doesn't hurt to reach out to someone. Also, a big part of what One Health Social Sciences does is we featured speakers through a somewhat extensive webinar library that we've covered a number of different topics looking at this intersection of One Health and social science. Now, moving from webinars, which are really somewhat of a passive participation, the new initiative among the One Health Social Sciences are work groups. And this is a new initiative that it supports the mission of the One Health Social Science by joining people from different disciplines using electronic media, the internet, GoToWebinar, GoToMeeting, Zoom to identify knowledge gaps in the social science and also to develop activities that contribute significantly to promotion of One Health. And also the idea is to build these professional networks. Currently, we're starting with 5 work group topics, and I encourage you, if you are out there listening and you're interested in joining one of these work groups, please send a message to the address listed there and put work group and the name of the topic of your in the subject line, and then someone will get back to you about engagement in the One Health work groups. And these, again, provide leadership opportunities also for people as an important part of workforce development, being part of networks where you are a participant or a leader, and with the results being publications, presentations, and other ways that it can help your career. So there's a lot of work, there's a lot out there about One Health research, practice, and policy. I do refer back to my colleague, Dr. Stroud, who's executive director of the One Health Commission. I want to put a plug in for a webinar that she gave recently through the webinar training, and here is the link to that. This is a webinar, again, that presents a great primer really on One Health and how One Health, examples of One Health. I also want to point out another initiative, the Center for One Health Education, Advocacy, Research, and Training cohort that was originally put together by Dr. Prajit at the Kerala Veterinary and Animal Science University. And one of their recent, in addition, I want to say they have a wonderful little video about One Health and how it is aligned with holistic approaches to nature that are part of Indian culture. But he has also established an excellent YouTube channel. If you look at a picture of Dr. Prajit, he actually looks a little like the guy here in this graphic drawing, and they have a number of resources in different languages. So I encourage you to check that out. So the take-home messages from today are that system problems need system solutions, and that One Health Social Sciences is an approach that can help to operationalize this, and that social justice and gender equity are cross-cutting One Health Social Science themes and need to be included intentionally in efforts at infection control and prevention and other health issues. And also that there are lots of ways to be involved. You can be a One Health advocate, and I encourage you to do so. Talk to your colleagues. I've put here some of the references that I've referred to. The one on the bottom is this paper that I referred to that my colleagues and I did that will just be coming out very soon in a special research topic in Frontiers in Public Health. I just want to say thank you. And these pictures, I wanted to show them to show that although there are sometimes what seem like difficult situations or insurmountable odds, there are ways by working together that we can have. For example, at the San Diego Zoo, a cheetah lives with a dog. Well, if a cheetah can live with a dog, a veterinarian can speak to an anthropologist or a medical doctor. Also, that the road may seem long. This is a picture of my husband on his first hike after his knee replacement, and you can still make it up that hill. Or this photo from Guatemala of these eggs about to take off on a very bumpy road. But with the right perspective and organization, we can move forward to advance this idea of One Health Social Science. So I want to thank you very much. And again, thank you for this opportunity. Again, I encourage you to become a One Health advocate. And I'm going to turn it back over to Paul now.
Dr. Streichert, thank you very much. That was a very interesting talk. Thank you as well for promoting the teleclass that we did just last week, and that was teleclass, please, not webinar.
Oh, sorry.
I'll metaphorically wrap your knuckles for that. Now, you provided your email address on the slide previous to the one that you're showing now. I presume that makes it acceptable for people to reach out and contact you if they have questions.
Yes, please do.
And I love that you're giving people a way to get involved directly through the work groups, and they can just contact you or that email address that you provided and get involved directly. That's fantastic. Let me ask you, are medical schools anywhere that you're aware of, anywhere, are they addressing One Health approaches, or are you still seeing the silos of human health versus animal health?
Well, there's a really, recently there's been a tremendous growth in One Health programs, One Health classes and programs in medical education and in public health. You know, as One Health has become more popular, if you will, there are programs and also joint programs, I believe, with med schools to be able to study One Health. And again, I would just look at specific med schools, but it is something that is becoming more integrated into medical education. Yes. I want to just put another plug out about that rabies study that I did for nursing students. That's an exercise that I developed to work with nursing students, and I would be happy to share that exercise.
Right. Well, your email address was provided, and if people didn't note that in time, they can contact me. Could you back up one slide?
Sure.
Thank you. I will just note the teleclass topics that are coming up. Dr. Bo Hansen from Denmark will be providing a really interesting lecture on assessing the clinical accuracy of a hand hygiene system. It's very interesting because all of the systems that have been kind of flooding the market during the COVID era, many of them have questionable efficacy. Vaccine hesitancy, boy, oh boy, aren't we seeing that? And there's a few other teleclasses there that you'll see. In fact, the Denver Russell teleclass, those of you who don't know Denver Russell or didn't know him, he was a gentleman who gave a teleclass many, many years ago, perhaps 19 or 20 years ago, and it remains the single most unmitigated disaster of a teleclass that we've ever had. Back then, the technology wasn't so great, and it did not work very well, but he remained, although he never gave a teleclass again, he remained a great friend of teleclass education, and he helped us a great deal. And that annual teleclass is in memory of him. On the very last slide, our patron sponsors are noted: Diversey and Virox and Gamma Healthcare and Purell and the World Health Organization. These organizations make it financially possible to keep going with the teleclass education now in our 21st year. Thank you to all of them. Thank you to all of you for joining us. And Dr. Streichert, thank you again for giving us this time. I know you're a very busy person, and it was an excellent lecture, and I know that it's going to be very popular. Thank you again, and we'll talk to everyone very soon. Bye-bye.
Thank you, everyone. Bye-bye.